Good afternoon, everyone. This is Dr Ruksana Kushter, consultant gynecologist at Primecare Medical Center, Bangalore. Today we are going to talk on the topic coronavirus, what a pregnant woman needs to know. We all know that WHO has declared the outbreak of coronavirus as a pandemic. And by now, all of us know a lot about coronavirus thanks to the social media. Though I'm going to talk about coronavirus in pregnancy, let me briefly touch upon coronavirus in general. So what is this coronavirus? We are now having an outbreak of a virus called COVID-19. COVID-19 is not anything new. It belongs to a group of viruses called coronavirus, and this is a new strain of the same virus. Let me give you an example. We all know that iPhone has been existing from a long time. Every now and then we get a new version of iPhone. So only the version is new, but iPhone is not anything new. Just like that, COVID-19 is a new strain of the pre-existing virus called as coronavirus. So what are the symptoms of this coronavirus? So the patient usually presents with fever, dry cough, malaise, shortness of breath. Okay, one thing we have to notice is usually a running nose is not a very consistent feature of coronavirus. So most importantly, we have to know that there is no cure for this disease, or neither there is a vaccine. So we have to give a lot of importance to prevent ourselves from getting infected by this virus. Now, when we are talking about women who are pregnant, so are these women more prone to get this infection? Although nothing has been consistently proved, the studies and the experts do tell us that the chances of the pregnant women getting affected by coronavirus is just the same as the rest of the population, but the severity may be a little more than what it is in the general population. So why is it? Why is the severity more? See, in pregnancy there are some changes, both physiological changes and the physical changes and the immunological changes, which makes a pregnant woman more prone to infections. Not only coronavirus, but any infection for that matter. So how are you going to prevent yourself from catching this infection? And if you do catch, how are you going to see that it is not very severe? So you have to build up your immunity. The pregnant woman has to build up her immunity. And how is she going to do that? By following a proper diet, intake of water, and also by taking proper care of the hygiene. So you have to take a balanced diet. And if you have any deficiencies, it has to be corrected. Say, for example, if the woman is anemic, or if she has any vitamin B12, vitamin D deficiencies, the doctor will test you for that and see to it that your deficiencies get corrected. Next is about water. It's mandatory to keep yourself well hydrated. Not only is it necessary that you take a lot of water. For instance, if somebody tells you that consume 3 liters of water per day, you should see to it that you're taking it at regular intervals so that your throat does not get dry. It's not just adequate to drink the entire amount of water in the morning and stay dehydrated in the afternoon. So see to it that you drink enough water, that too at regular intervals, and preferably warm water, at a room temperature water, not cold from the fridge. And always see to it that your throat does not go dry. Why? Because this virus multiplies and thrives in a dry atmosphere, in a dry throat. If you keep yourself hydrated, it will be washed away into your gastrointestinal tract and it dies there. Alright, so whatever your doctor prescribes, the iron, the calcium and the vitamin tablets, please take them because it will improve your immunity. So this is how you build up your immunity in order to decrease the chance of getting infected. So what are the other measures which have to be taken not only by pregnant women, but by everyone. By now we know the importance of washing our hands. Although we all know that washing hands with soap and clean water is necessary, what we forget to do is the time factor. It's not just washing your hands under running water. Please spend 20 seconds to wash your hands, and see to it that you use a soap, create a proper lather, see to it the area in between your fingers and the entire hand is washed properly. And your hands should be washed before you enter the house, before you eat, before you start cooking, before and after you see your patients. Before any work, make it a point to wash your hands with clean water and soap. Sometimes it might not be possible to get water and soap everywhere. So please carry a hand disinfectant with you, hand sanitizer with you. And when you buy a hand sanitizer, make sure that it contains at least 60% of alcohol. Next is, when you consume fruits and vegetables, please wash them in enough clean water. Leave it rinsed in water for some time, preferably salted water. The same thing goes before you use meat. Okay, everything should be properly washed and properly cooked. So the other thing is, you have to follow what is called as respiratory etiquette. By now we all know that this virus spreads through droplet infection. That means if an infected person sneezes or coughs, and this virus, you come into contact with this virus, then you are likely to get infected. This is called droplet infection. So we have to follow what is called as respiratory etiquette. What is it? When you want to cough or sneeze, please do it into a tissue paper and take adequate precautions to discard this tissue in a proper dustbin, which should be kept covered. Not throw it around. That does not serve the purpose at all. And if you do not have the tissue paper, please make it a point to cough into your elbow, your arm, because that part usually does not come in contact with your nose and mouth, and it does not spread to other people too. So this is respiratory etiquette. That is how to cough, how to sneeze, and always when you want to cough or sneeze, if there are people around you, please go at a distance to cough and sneeze. The next point is it mandatory to wear a mask? The WHO does not recommend so. It's not necessary for all of us to wear the mask. Mask is only for those people who are suspected to be affected or having a respiratory tract infection, or who are infected by the virus, or even the healthcare personnel who are taking care of the infected person. Now when you wear a mask, whatever kind of mask you're wearing, there is no point in wearing a mask and spending the whole day with it. You have to discard it at a 6-hourly interval or when it becomes wet. And this also has to be discarded in a proper dustbin. Okay, this is respiratory etiquette. So, is there a vaccine for this? No, there is no vaccine for this, but we only came to know a couple of days back that one of the major pharma companies are testing this vaccine on an experimental basis in the United States of America. And what about medicines? Are there any drugs for this? They have been trying out a drug called remdesivir. We have to wait for some time to know the real effects of this medicine. Alright, so this is generally about coronavirus. And another thing, before we go into pregnancy per se, apart from this respiratory etiquette, we have to disinfect all the things around you. That is the table, the chair, the door handles, the light switches. Please disinfect this with whatever disinfectant you have at home, and avoid touching these things unnecessarily. And please avoid touching your eyes, your nose and your mouth without any reason. So this is all. Now about coronavirus in pregnancy per se. So what will happen to a woman if she is pregnant and she is exposed to people who are affected by coronavirus, or she herself gets infected with coronavirus? Fortunately or incidentally, not many cases of pregnant women with coronavirus have been reported. A very handful of cases have been reported, and the behavior of the disease has been the same as in general population. So whenever we study the effect of a disease or any drug or an external factor in pregnancy, we always divide it into its effect in the first trimester, the second trimester, and the third trimester. We all know that coronavirus has been detected in the last week of December 2019. So obviously we don't know what happens. There are no women who have been affected in the first and second trimester. So we don't know its effects as well. Few women who have acquired this infection obviously have been in their third trimester. And what has happened to them? All of them have delivered by cesarean section. Not because they had coronavirus, but because of some other factors. Like for example, say there was fetal distress, there was CPD, there was hypertension, whatever reason. And they have done study to find the presence of this virus in amniotic fluid, in the cord blood, in the breast milk, in the throat swab of the nose of the newborn, and also some studies they have tried to find if there is presence of virus in the placental tissue. Fortunately, the virus was not detected in any of these tissues, and they have concluded that there is no vertical transmission of the virus. What does it mean? It means there is no chance of a mother infected with COVID-19 to transmit it to the newborn. Having said that, we have to remember that the mother might infect her baby postnatal, that is after the delivery, because of close contact. So that is the area we have to be careful about. So now we know that the virus, we don't know about the effect of the virus in the first and the second trimester. Third trimester, till now there has been no adverse effect. But I already told you that COVID-19 belongs to a family called coronavirus. In the past, we have had two huge epidemics of what is called as SARS and MERS in 2002 and 2012 respectively. And since that was prevalent for a considerable time, studies have been done of the effect of this virus in all the trimesters, and they do have reported the increased incidence of abortion, preterm birth, intrauterine growth retardation, and in fact even IUD, and a few babies with congenital defects too. So we have to be alert that since this virus also belongs to the same family, all these are possibilities. Alright, so what happens? Now the question arises is, can a pregnant woman feed her child? Can she give her breast milk to the baby? So since we know that there is no virus detected in the breast milk, breastfeeding is not contraindicated, but the usual precautions of wearing a mask, washing the hands, taking proper sterile equipment, all this is necessary. Or you could, if the mother is really worried, she could express her milk and give it to a healthy individuals to feed the baby with the breast milk, because we all know how important breast milk is to the baby. I think the youngest child with coronavirus they have detected to be is around 36 hours old, and this they found out was acquired through the contaminated material. So in these times of coronavirus having become pandemic, what about antenatal care? Do you need to go to your doctor regularly at the prescribed schedule? Or do you need to postpone it for some time? Or do you need to go to the doctor only during emergencies? The WHO says that if you are not infected, if you are a healthy individual, please keep up to your appointments with the doctor. But make sure you go with a prior appointment, and please do not take a lot of relatives to the hospital. We all know that we have to avoid crowd and follow your doctor's orders, especially so if you are in the 3rd trimester of pregnancy, because this is a very important trimester where a lot of changes do occur in the pregnancy, even to the fetus. So it's very necessary to have your regular checkups. Of course, if you're having respiratory tract infection, if you're suspected to be infected, you're in quarantine, then at that time you don't have to go. So what about travel in pregnancy? It's better to avoid large crowds. It's better to not to travel to other places. Or if it is very mandatory, if it is very necessary for you, follow the WHO travel guidelines. But unless absolutely required, it is better to avoid traveling. And a little about the healthcare personnel who have to take care of this pregnant women infected or suspected to have COVID infection. Again, I emphasize, please wash your hands. Though all of us know, I've personally seen that not many people take proper care of this. They may wash their hands, but they do not spend enough time washing their hands. So always, before every procedure, before checking a patient, wear your mask and wash your hands, and please discard your masks properly into the allotted dustbins. Isolation of these patients is very important. Not all the staff present in the hospital have to go and attend to the patient. The person assigned will go. Isolation is very important, and hygiene is very important. So that's all about coronavirus in pregnancy. We are now open to questions.